Hi guys, so the next thing that I wanted to touch on is kind of my general experience with medical professionals. In Germany, had that was when I first really started to actively look into what was wrong. That was the point where I was going to the doctor, and the doctor would say everything's fine, send me home, and I would just take that at face value and not really ask any further questions and not think about it anymore. And then that flip switched, and I was like, wait a second, if everything's coming back normal, but something is still off, I'm still suffering from all these symptoms, then we need to be running other tests. We need to be looking, a bit further than just the first few tests that come to mind. And that was when I kind of pushed my doctor, and I said, something is definitely wrong. This is not normal. And if these tests are normal, then we need to run more tests. And he initially agreed to have a few more tests run, and everything still came back normal. And I sat in the office and had this little back and forth with him where he's saying, everything's normal. Don't wish this upon yourself that you would have a serious illness. Everything's come back fine. I had to stand my ground and say, but still I'm not. I'm clearly not at the capacity of a normal, perfectly healthy person. And he got really angry, like raised his voice, and stood up and opened the door to allow me to leave and said, you know what, you've already wasted 15 minutes. 15 minutes of my time, and showed me to the door. So obviously, this is my primary doctor. Obviously, I searched for a new one after that. The next one I found was really nice. He gave me referrals to be seen by several different specialists all over town. Actually researched himself to inform myself about different illnesses that I was later diagnosed with, because these were illnesses that he wasn't familiar with. So I'm not sure exactly when I started choking on my food. I have friends who say they can remember me choking in high school, maybe even as early as middle school, but I myself can't remember a specific incident where I was choking on my food until I was in college. It was at that point that it probably stuck out more in my mind, because before that I would choke very briefly and then I could very quickly get it cleared or get it back up. And at that point, that year was, I guess, when things started to get more serious, where it would get blocked a lot more firmly, where it was a lot harder to get it cleared. And also there were other people around freaking out about what was going on, which stressed me out even more and made me feel the pressure to get it cleared even more, so that they would calm down and not panic and insist on going to the hospital, which I didn't feel was necessary. So then a year later, I had my first real impaction where the food was like solidly lodged in my esophagus, and none of my tricks worked to get it up. I couldn't drink anything and swallow forcefully to push it down. I couldn't try to gag or beat on my chest and cough it back up. Like, it was very firmly lodged. And if I did try to drink or eat anything else, it would just get lodged on top of that, and then I would, that gag reflex would kick in, and I would be able to cough up whatever was above the blockage, but the blockage itself stayed in place for 4 hours before I finally said, okay, I was at a picnic and I thought, before I go home alone and something happens, and there's nobody there to call for help, let me just go to the ER. So in the ER, they wanted to stick this tube up my nose to make sure that it wasn't caught there, that it was really deeper. And once they determined that it was, they said, okay, so we need to call the doctor to have it endoscopically removed, but we're not going to call him now at midnight. We're going to wait until 8 a.m. Because, you know, it didn't seem that urgent. It wasn't like I couldn't breathe because it was on the, you know, the food side, not the air side, but okay, the thing is, I had about 90 minutes from the blockage before the saliva would fill up and it would start blocking my airway, and then I would start choking and I would have to heave the saliva up so that I could breathe again. And every 90 minutes when I got to that heaving point, it was painful. So I'm like, you know, why do I have to deal with being in this pain every hour and a half all night long just to avoid inconveniencing the doctor who's on call? And isn't this gonna increase the amount of damage that's ultimately being caused if this thing is lodged here 8 hours longer than it needs to be? And the other thing was, after they removed it, when I was in the hospital, I don't know if maybe I commented on the fact that everyone in that wing of the hospital was like 80 or 90 and I was by far the youngest one, and it really stood out because I'm much more active at night, and, you know, not only would I be awake at night, I was hungry, and, you know, to them it was like really disrupting their routine to just, like, and not like I was going anywhere, but just the fact that I was awake and asking if I could have a snack or something. And I think I might have commented on the age difference, and the nurse said that basically the only reason I'm there was because I need to chew more carefully so that I don't choke on my food. Like, you know, basically I was just, you know, I was talking and chewing and I bit off too much, and that's why it got stuck. You know, as if I had done something stupid and this was my fault. And I remember getting out of the hospital, maybe just a week later, I started choking on my food again, and it wouldn't come up at first, and I was just like, you know, why would I let this happen again? Like, why would I do this? Like, how stupid can you be? And I just, like, you know, really beating myself up for this. And luckily I did get it up, because I was like, you know, I would be so embarrassed if I have to go back to the hospital again a week later. And it wasn't until about 6 weeks after I was in the hospital that I saw another doctor for a checkup, and they said, no, basically if the food can pass your throat, then it should be able to pass all the way down through your esophagus. And the only reason it would get lodged is if your esophagus is inflamed, and it is inflamed because you have eosinophilic esophagitis. And I don't know, like, why would the nurse then tell me, you know, like, okay, maybe the nurse wasn't informed, but I also don't feel like, you know, it's the nurse's place to be spreading misinformation and creating that feeling that I was somehow responsible for something which I'm, you know, not responsible for. I think this is pretty much the only negative experiences in Germany that come to mind. Okay, so I recorded the rest of the video a few days ago and then realized that part of it seemed to be missing, so now I'm trying to go back. One more thing about Germany was that I was seeing this neurologist slash psychiatrist who I originally started seeing for fatigue, and she tried to prescribe me antidepressants, saying that I definitely don't appear depressed, but I should try them anyways because maybe they'll help with fatigue. So I gave it a try. It was a horrible several weeks. Finally, I decided I just couldn't bear it anymore. I had to stop. And months later, I saw her again about this pain that I was having in my wrist. I had already seen a bunch of other doctors and I was doing physical therapy for it, but it just wouldn't stop, so we wanted to see if it was nerve damage. So I was seeing her in the capacity of a neurologist instead of a psychiatrist the second time. But when I went in there, I said, you know, I could barely manage the 5-minute walk to your practice, and I can't keep working anymore like this. She agreed to write me off sick, which I was so grateful for, but I didn't realize until much later that for the code for why I was being written off sick was depression. And I did some looking online and realized that apparently some dentists will even use the code for depression when you get sedated because they don't have any other code that's more fitting, and depression is sort of like the default go-to, you know. But depression is one of those things where if it gets out, it could cause you problems in the future, and I didn't know what specifically, but I felt like just in case, I would rather have the record set straight. You know, it's one thing if you actually suffer from depression. Since that's not actually my issue, that's not what I wanted on my record. So I tried to get it changed, actually, probably at least the first 6 months that I was living in France. I continually was making international calls and emails and sending letters and doing whatever I could to try and get this doctor to correct this diagnosis, which she absolutely refused to do. And I never managed to speak with her directly and get a reason, but her office made it very clear that I was not welcome to continue calling back, and no matter what I tried, there wasn't going to be anything changed. In France, okay,